Imagine that Monday feeling when the effect of coffee wears out. Your long to-do list looks extremely overwhelming, and going through the entire week feels like you're running a marathon. Yes, we are talking about burnout, a new pandemic which is spreading like a wildfire. A recent study by Gallup states that approximately 76% employees worldwide reported a burnout, costing global economy a solid $1 trillion in lost productivity. And burnout does not discriminate. From corporate employees, entrepreneurs, teachers, lawyers, parents, and even healthcare workers are all getting affected by it. The guest we have today, Dr. Prarthana Packiam, has done intensive research in the field of burnout and its consequences on mental health. She will help us understand what burnout is, why it happens, how to identify it, and most important, how to avoid it in the first place. So let's dive in and cross that bridge. Dr. Prarthana, welcome to the show. It's a pleasure to have you here. Burnout is a term we use very casually these days. What exactly is burnout from a clinical perspective, and how do we differentiate it from general stress and fatigue?
Thanks, Gurpreet, for having me here. So, burnout is something which needs to be talked more, I would say. Just when you see the history of burnout, it recently started from 1950. And it is that Friedenberger is the first guy who talked about burnout. So it's not there for a very long time. So those questions are really relevant for our, for this century, I would say. Burnout, particularly in ICD-11, which is International Classification of Disease, is not considered as a medical condition even. It is a chronic work stress, and it is defined as an occupational phenomenon. So as you could see, it's not there for a very long time. Probably in the last, 50, 60 years, more is talked about burnt out. And the three main things about burnt out is having mental exhaustion, or we call it as emotional exhaustion, where you feel irritability, not wanting to do anything, really, feeling lethargic. That is one typical cornerstone for burnout. The next one is depersonalization, which means that you feel cynical about lots of things. So, which means that you would not be able to connect with people. So the trust goes down, and particularly more cynical about the workplace. So that's one thing, which is the depersonalization. And the third thing is about the productivity, the efficiency of the person gets reduced. So these are the main three things they talk about burnout, but they do present with different symptoms. But these are the more, I would say, a vital thing to classify for a burnout.
Yeah. So you mentioned depersonalization, right? People not having trust in what they're doing, or what in the people, they become more cynical. Isn't that boredom sometimes? You've been doing, let's say for example, someone's working in a corporate, in a job, in a healthcare sector. They've been doing this job for a number of years, and then you eventually get bored of what you're doing. Is that not a part of? Is that a contributing factor as well?
You rightly said, Gurpreet, that's very true. People lose their purpose and meaning, and they feel that it is very monotonous. Their job is, they cannot feel any purpose or meaning for what they are doing or what they're adding value to the work, and they feel very unappreciated. So they might be thinking that they are adding value or anything, but they don't hear it from their boss or from their colleagues. So they feel, why am I even dragging myself to the work? So that is becoming more cynical. So when they're becoming more cynical, eventually they want to guard themselves by shutting themselves off with people. So that's when they go into that spiral down, where they don't reach out, and they keep themselves to themselves. And what's happening is basically in a phase of being dark place, like where they can't come out. So that's what is happening with depersonalization, where there is not much trust around people, because there is also fear of social stigma about talking how they feel in the workplace too.
Especially in corporate jobs, when the moment you say you are not feeling mentally there, or you're not feeling like you're 100%, and then you're in leadership position, you can't really be vulnerable around your juniors or your leadership yourself, right? So I totally understand. Now, what are the typical symptoms one can themselves acknowledge, right? Let's say I'm working in a corporate or in an industry which has a massive work overload, right? How do I acknowledge based on some of the symptoms I feel like for how long I have to feel that way to classify quote unquote burnout?
Yeah, sure. So just with burnout, as I said before, like there are three things to classify, but usually when it comes to physical symptoms, there are lots of people who start feeling some physical pains. For example, some people will present with migraines or abdominal pains like myalgia, body aches. So people present with physical pain. The other classification, they also come with mental exhaustion. They feel really tired. They're feeling low energy all the time. They cannot push themselves out of the bed. So mentally, they are feeling very drained out. Even they have not even started the day, but still they feel very drained out. And any thoughts about work, they just go into a state of fight and flight mode, like kind of like they get overwhelmed and they get stressed because they see work as a very big threat. So that is very typical. The place where they usually go and they have to enjoy because they're very passionate about it, that's the same place they pull themselves off. So they lose their joy out of what they're doing. So they are very typical signs of burnout. And it's not only the feeling, your body responds very differently. So you go through a very physiological stress response. That is the one that is making them very unpleasant. Some people start breathing very heavily. They feel like they are tight. They are closing up in the throat, and some people having this physical pain, intense physical pains. And I have also heard of one person getting admitted. I have a spectrum of people with burnout, but one person was admitted, and she was kind of a musical person, and she didn't know that it was all because of burnout. She was really working hard on those days, and she got admitted because of the abdominal pain. And that's when they realized like it could be from mild to severe spectrum. So there could be a range of burnout symptoms.
So what you're saying is burnout is not always mental or emotional, it's also physical, right? It can manifest in terms of physical symptoms. And it's not just limited to some of the industries, like even musicians you mentioned. They're creating music and they can also feel burnt out.
Absolutely. So it's I was reading the research on burnout and which people can get high. People who are very highly ambitious and people with the very perfectionism type of personality. So they are the ones where the burnout happens more because they put themselves in a very high pedestal. This is what, and I would say it's a kind of like an unrealistic expectation with a limited period of time. And they push themselves so hard, their basic necessities are not met. And what they do is they keep running through their stress response, which is your cortisol response. They keep pushing themselves hard to achieve their goals, and not meeting their basic needs, even having a proper food or your sleep, having some rest. So constant stress response and thereby just getting burnt out.
And then they want to drive energy from coffees, right? And which further elevates your cortisol, right? So sort of feels like being there, done that. Now, how widespread is this burnout from your experience and practice? And are there any specific industries this is more applicable to?
Yeah. So according to Australia, we are the highest in burnt out. Like we score high, I believe. Like I think there is a higher percentage.
Yeah, I was reading some stats myself. So globally, it's around 48%, right? The baseline global baseline is 48%. Australia ranks highest in the world at 61%.
That's very true. And not only that, there is a very recent UK study that came out for burnout. And at one single point in the last 1 year, even 90% of people suffer from burnout. And particularly people who just started their job, like the young generation, when they just started in, those are the ones who have, like students. So they are the ones who had very high burnt out rates, I heard. In talking about industries, the project management and the IT field, they are the ones who have who top the list, and then comes the healthcare, then the social workers, quality assurance field, and teachers. So the person whom I was talking about is actually a teacher who got admitted in the hospital. Like she was a teacher, musical teacher in the school. So, and I have also seen more number of cases in people project management and people in the CEO levels. So it doesn't, what should I say? Everyone gets it. So there is no one who is immune to it in terms of a burnt out. And have you heard of care fatigue?
Yeah, I've heard of that, carer fatigue. And incidentally, I met someone recently at a cafe, and his friend's father, right? And when we were talking about, oh, we just working long hours these days. This guy is 7 a.m. at a cafe, and this guy is already working and with his laptop on, and his father sitting next to him. And apparently, I said, man, why are you working so hard? You're probably gonna get burnt out. Like, it's only 7 a.m. You can start a bit later. Oh, no, I got too much. I finished up like at 12 in the night, and I had only very little sleep, and I'm back to work. And his dad sitting next to him, he said, I am more burnt out than him. I'm more burnt out than he is. And I said, why? He mentioned his wife is hospitalized for the last 2 years. And every day he has to make a trip to the hospital, be the caregiver for the entire day, and come back in the evening. And while he was talking about it, he started crying. And he said, I'm depressed. I think I'm depressed. So I think there's a very thin line between the symptoms of how burnout feels and how people perceive it as a depression. So what's your take on that?
Yeah, it's thanks for bringing out that example. So people think burnout is only in a work environment. So that's not true. As you said, like your friend who has been a caregiver, like particularly for his father as well as for his wife. So the caregiving jobs could also be a very draining thing where you have to juggle more things. I have seen women do get more burnt out because they take the roles of balancing between work as well as at home. To answer the question about depression and burnout, actually in depression, the constant low mood, it's not necessarily secondary to work. So in all areas, for example, this one is very particular to work, right? Like they're very cynical about work. So usually with depression in all areas of your life, in all environment, they lose interest. They don't really only fret work. It's not only that place. Everywhere, they just want to completely shut down. So their chemicals are not producing. They're not having their serotonin to just push themselves up. That motivation hormone, dopamine, nothing is working for them in terms of depression. But burnt out is can be directly role related, but it can also spill into other areas of your life. It's not necessarily if your house life is not good, it can also spill into your work life. And if your work life is not good, it can also spill into your house. So, but in depression, it's constantly, there must be something that's bothering them that could have been an underlying stress that's been happening for a very long time, not necessarily secondary to the role they're doing.
Could be underlying traumas for them, right?
Yes, that's very true.
So in a sense, burnout is more work-related. Depression, you can have it, the multiple reasons for depression, but mostly the burnout happens purely because of the work-related factors.
Absolutely. So the culture of the work, I would like to mention here. So I have seen many people coming in looking out for help for burnout purely when the work culture is toxic. So when I'm saying toxic, what it means is just expecting targets, just expecting outcomes, and not considering or not putting any energy on the person or the process who is helping them to achieve the target. So just opening up the minds and giving them the space for work and the employees, just to build a trusting environment so that they can open up and talk about their issues could make a very big difference. Because burnout, the most important thing is to seek help. Because just imagine if you're like in a boat and you're sinking and you don't know swimming, the first thing you want is your life jacket or a lifeboat So that's exactly what your environment can give you. So when I'm thinking, when I'm in burnout, is there anyone whom I can trust, where I can open up my mind and talk? It could be as simple as that, that can make a very big difference to the progression of the burnout. So creating that culture of space and trust can make a very big difference for burnout and the outcomes of burnout. And funny enough, people who have had burnt out is the ones
They
who
don't
had.
seek help. They don't seek help.
Yes, they don't seek up. Not only that, their productivity gets decreased, and that's when, like the Australian economy, they say like about 16 billion, I
Yeah.
believe, have reduced productivity. So what I'm trying to say is, your productivity would improve if the culture of the work would be different. It doesn't need to be a massive difference. It's just a space which is a trusted space for them to hear it out. The education and awareness around mental health, that everyone goes through it, and not to stigmatize that or punish that for feeling certain way, and to reach out for help.
So you mean to say the corporates or the workplaces per se should acknowledge burnout, as it is, and without stigmatizing it, right? If someone's complaining of a burnout, they should take it seriously, because eventually they have to pay it regardless. By
Absolutely.
losing an employee or the productivity goes down.
Absolutely spot on. Just imagine how much you would have invested on that employee to start with, to give them the induction, the training. So, whatever you have done on that person can all go south if their mental health and their emotional health has not been addressed. So, instead of putting a door to shut it off, I'm asking the culture to change, where they can open up and they can be, keen to, for them to reach out to them, so that they don't shut themselves out, so that their productivity decreases. Actually, you're going to create an environment that's going to help them, not only them flourish, your company flourish too, thereby. It's an indirect effect of it, having them emotionally and mentally prepared. So that's where the coaching comes, right? Like lots of people get coached at their work when they are feeling certain ways, so that their productivity increases. So the emotional and mental health can play a very big role. And if you're going to pick early, and there are certain companies, they have something called as a mental health first
First
aid.
aid, I've heard of that.
Yes, yes. And it is very recognized in Australia. There are people who are trained for the mental health first aid, just like our safety first aid for anything. Like when we get a bruise or when we have a fall, it's a mental bruise. It's not something that is disability or anything. It's just a mental bruise there, where you can just put a first aid. And the first step for the first aid is to create a culture which is safe for them, so that they open up and talk. All they need is an acknowledgement what's been happening, and thereby it can improve their credibility and productivity too.
So there's a paradox I see, and the way because you just mentioned that the culture should change in organizations, right? There should be culture of more openness and acceptance of burnout as a phase of someone's mental state. And when I did some minor research, I found that it's a leadership roles who are predominantly more prone to or vulnerable to burnout. Now, when the leader at the top is already burnt out, how can he induce a change underneath? Or what's your experience been? Like you come across a lot of C-suite people as well as your clients or as your patients. How do you see that trend happening?
Look, thanks for bringing that question. It's very important that I have a very big passion on changing top down, because the culture starts not from grassroots level up, it's from top down, I believe. So people who are in that position, if they are aware of mental health, particularly in leadership positions, no one is immune to it, isn't it? So particularly people who are in the leadership are the ones that have too many roles and too many responsibilities for them. And they have to be extremely aware of this one. So when they have had the first-hand experience of having mental health awareness, and when they realize the importance, I should bring this example. I had a CEO. She was presenting with migraines, and I asked her, "What is the value of you not working?" And she gave a very big figure of almost like a week or 2 weeks. She gave a very big figure of how much she lost financially. Is only financially she was talking about. So it's like thinking, wow, that's a very big figure. So when she reached out and we talked about it, at the end of the day, like we were able to look into what's happening, the spiral of the burnout, and we were able to figure out the triggers, and we were able to address those things, to put in place so that she doesn't go back to the same state. It was quite eye-opening for her. The word she used, I still remember, which was very fulfilling consult for me. She said, I feel infinite now. That's the word she
Wow.
used. So from there, it starts from there. So when the leaders know that no one is immune to it, particularly people who have different roles, and embracing the idea rather than pushing it out and stigmatizing it, could make a very big difference. Absolutely.
So I think when someone's experienced it firsthand, they have more empathy towards people who can potentially be more vulnerable to that, right?
Yeah, can't agree enough, Gurpreet. Personally, I have experienced burnt out too. So that's why there are lots of doctors who experience burnt out too. Like there is a support groups for burnt out. And in Australia particularly, there is a Black Dog Institute for burnt out. They have some questionnaires as well where people can just Google in and put their numbers in. And if they feel if they are burnt out, they can reach out to their GPs or reach out to someone whom they trust. Having coming back to the question about burnt out and the leadership roles, right now that's what we are planning to do, right? Like it's not something that is a bit of a stigma. So the main purpose of our podcast is to educate people more about burnout is real and it can happen to anyone and no one is immune to it. And just embracing that idea would make a big difference from top down, so that the culture changes, work culture in particular.
Yep. So from your perspective, you briefly mentioned that women are more, you see stats, women more burned out than men, wherein the still majority of corporate jobs, again, I'm pro for supporting women in the leadership roles. But how does that work? Is that because of they have to balance work and family both? Is that why it is, or what do you think is the reason behind it?
We are now in the era that we talk about equality in job sharing and stuff like that between men and women. But what usually happens, women do take a lion's share of work at home, where they do parenting and whatever roles they have to do outside of work. They tend to do it more, I would say. So when they are really having lots of energy spent there, as well as they have their work on the top of it. So I think that's the reason that women get burnt out more than men, I would say, because they naturally tend to take the role of a parent or other jobs that they have to do outside of work. So women are more prone for burnt out. Yeah.
Yep. There's a concept of color coding your mental state, like from green, amber, red. What is that? I've heard a few theories floating around. So if I may ask.
Thank you so much for bringing that up, because lots of our mental health depends upon this green, amber, and red. Just to put a scientific name to it, we call this as polyvagal theory. So learning happens when you are in your green mode. Compassion, the curiosity, the social engagement, everything happens in the green mode. To be frank, your productivity increases dramatically when you're in this green mode. That's the mode we want everyone to be. So the amber and the other mode is the red. The amber and the red modes is the survival modes. So the red mode is where you have a freeze reaction. We also call the survival mechanism. I'm not sure if you have seen documentaries in the National Geographic Channel when a lion chases the deer, just freezes so that it can escape from that situation. Because freezing is actually a survival mechanism so that the lion can escape that situation by lying still, acting dead.
Dead.
So that is the red phase, and it can happen in humans like us.
So how does that manifest, the red phase in humans?
Absolutely. Now, people who are working think their employers as the lion. So they think that the culture that they are in is similar to a lion. So our body reacts the same way a deer reacts when it in terms of the survival mechanism. So when we see a threat, we go into the freeze phase. It's really hard. That's the phase that we don't want anyone to be.
So we can say that's the phase when we give up.
Yes, that's where the shutdown happens because they were constantly running on stress and stress and stress, and that's the burnout. That there is no, that's not a good place to be in. So they freeze. The next phase we talked about, the amber, is the fighting phase. I want to fight here or fly away. At least they have some energy to fight or fly. The amber phase which we talk about. But these two phases are survival phases. So it's the perception. They are seeing people who are in burnout phase that are possibly can also see their workplace as a threat. They can see that as a threat similar to a lion. So if that's happening, you're constantly in a survival, constantly proving yourself. Instead of survival, you have to prove yourself, otherwise you're going to get sad. If that's your mentality over there, you're going to constantly burn yourself out because you're going to produce more of the cortisol response. So once the cortisol response is going to be done, you just go fall down. So that's when the exhaustion and all those depersonalization and everything happens. The efficiency decreases. So we don't have lions, but people perceive their boss or that work environment as a threat. Any real threat can produce the same reaction as if you're chased by a lion.
Gotcha. That's why there's a lot of analogy, and it's hard to kind of to make sense out of it. Like, no, thanks for bringing some good context to it. So let's also discuss green, amber, and red modes a little bit more in detail. Now, the reason is, if let's say hypothetically I start my day in the morning, am I always in a green mode and then slowly transition to an amber mode and then to a red mode? Is that how it is? Or I'll stay in green mode for some days and then amber mode for some days, and then I'll eventually, if the burnout is not controlled, I'll move to a red mode, and then the shutdown happens. How does that manifest in the real life?
Look, everyone is very different in the way they present with your survival and coping mechanisms. One thing is like to be intuitive about what's within you, like reflecting. So if someone is really running in very fast, they cannot stop and reflect. So people who are in amber and red mode, the main thing that happens is they constantly burn themselves out by running, by working hard, and they don't have time to reflect what's happening within them, how their body is responding or reacting. So what I would say is, like, it is possible to switch between modes even in a single day, because there are one area of the meeting that they would not like it. So they can be in a red or an amber mode there. They will freeze, they will shut down, they don't even open their mouth. And there is another place that they would really enjoy doing in the same day. So it is possible. It is possible to revert. But if someone is in those modes, the best thing to do is certain techniques, simple techniques. Just taking a pause can be very helpful in that moment. Just taking a pause for 5 minutes and just going out and clearing the mind or getting some fresh air, being in the nature. Simple things. You don't need to do a lot for it. Just going out. And we call this couple of things. One, we call it as breathing techniques, which is comes under grounding. So you just go out, see 5 things that you can notice when you're in that mode, and 4 things you can hear, and smell. And these are the things that you can look around your environment. So what you're trying to do here is you're stopping to be in your mind, and you're trying to ground yourself to the present moment. That's also called as mindfulness. That could be a great tool, and it is very cost effective. You don't need to buy anywhere. It's within you. So that is a self tool that you can have. The second thing is breathing techniques, which is 4, 3, or 7. Like, you can breathe in for 4 seconds, hold on for 3 seconds, and breathe out for 7 seconds. So that will also calm yourself. Remember when I said about the green, red, and amber things? It's called as polyvagal. So what you're eventually doing when you're doing the breathing techniques is you're learning to activate your parasympathetic, that is the vagus nervous system, because as you say, it's a physiological response. It's not your mind alone, your body is also following that. So by doing that breathing technique, you're calming yourself down so that you're not feeling stuck. You're not feeling that freeze mode. You're not feeling like fighting or flying away from the situation. You're coming back to the green mode. So how efficient you do is coming down to your practice and your personality too. Yes.
So the personalities like type A personalities, which are mostly, driven, and they're more like go-getters and achievers, they are more prone to these sort of things. I think it's a good practice to take back home from this podcast, that you gotta go and invest in self-care. Now, just as an extension of this discussion, what will, when let's say a patient comes to you with burnout symptoms, what would be your first line of treatment for that person?
First, I would say hats off for them, because like even coming out of their shell to ask for help is a big thing. It's the brave thing to do, to ask for help. Look, of course, I believe in self-care, and that is a vital thing to turn around things. But when you're sinking, you cannot swim. You need your life jacket.
Yeah.
That is your help around. So when someone comes there, first we will do some questionnaires to check about their severity, and just acknowledging and appreciating that they are asking for help is it's an important thing. And giving them some amount of pause to reflect. And there are two things. One is the stress and one is the stressor. The stress is your body's response. So we have certain things to control your stress in the body. And second is the stressor. Stressor is, for example, your financial stress or your boss expecting so much out of you. Your stresses will never change. So coming to your doctor, I'm not going to change your stresses. But what I'm going to tell is about your stress that your body is responding. That I can help you with. But the stresses, after they have come to the green mode, they are the ones who have to take care of those things. Remember, like how you're going to talk to your boss about delegation of your work and how you're given over, whatever it would look like. It is the second step. But the first step is to manage their body, because it's just going berserk. So that's where we need to acknowledge, and we will try to calm them down at the first place. The best thing I would give someone is, like, we have heard of to-do list. Mm-hmm. I would want a don't-do list. So is there anything, because when we say type A personality, they want to conquer the whole of their schedule with lots of ticks. I have known people, remember the CEO who was talking, she was saying, I want to tick everything in my day. So stop that one. Is there anything that you don't need to do? Put that in your list and set your boundaries right. Yes, we know that we all want to create an environment which is more productive for the company, but at the same time, not at the cost of your needs, not at the cost of where you're feeling overwhelmed. So having your boundaries right. So these are certain strategies that we can work on once their stress response is calmed down. So when, as I said, like when the deer is in the freeze mode, nothing happens, no learning happens. So it has to come to the green mode for the learning to happen. So to do that, we have to do those techniques, as I said, about meditation or relaxation, those practices. But if it is a very severe component, we can look into that. If there is any underlying, apart from the burnout, if there is any underlying conditions that's been not addressed for a very long time, we can look into that one as well, because it can go hand in hand with other conditions like depression that's not been taken care of because they're worried about the grief that they didn't deal with, or any other comorbid mental health conditions can be talked about as well, because it can present at one area as burnout, but underlying if there is anything else is happening.
Yeah, I think you touched upon a very important point. I have two questions from it. One, obviously, and I'll come to that a bit later. Firstly, continuing with the line of treatment. So first is acknowledging, helping them with self-care. But what if the person is constantly in that amber and red mode, and he's not supportive enough to go back to his green mode because his body is not helping? Do you also recommend some sort of medication? Is that also a line of treatment, or is only usually the self-care? The reason I ask is so that someone who's going through the burnout phase should know where to go. Should he go to GP or a therapist?
Okay. So first come to the GP. They can try finding out what level of burnout they are. Look, for example, it comes down to their symptoms. If they're not eating, if they're not coming out of their bed, it's quite severe. They're not able to function. So we would tend to give them an antidepressant as well. Like if they are having it for more than 2 weeks, if that's what they're doing, I would do an antidepressant to get them kickstart for that one. So till the therapist is to get them some strategies to calm them down, but to bring them out, we definitely need some medications. And if it is as simple as they're losing their sleep, there are lots of sleep medications which are quite natural ones that we can try as well for them to come out of that, to break that cycle. Because when you're going on into a cycle spiraling down, just getting their sleep can turn things around. And eating a healthy breakfast or eating a healthy food can turn things around. So it comes down to the severity. Yes, we do tend to give medication if it's in the severe phase of burnout where nothing they want to do. Then yes, of course, we need to support them through that. Yes.
Yeah. So the idea is to bring the cortisol down in
Yes.
terms of, be it through breathing exercises, yoga, meditation, or through medication.
Absolutely.
Right.
Absolutely. Yeah, I mean, we need cortisol so that people just get confused with cortisol. We need cortisol to kickstart our day. That's why, like, when we wake up in the morning, when the sunlight falls on us, we need our cortisol that kicks in, and that's what makes us going. But if you're in a cortisol peak response all the time, which means as if you're attacked by a lion, then what happens after a very long time is you just get burnout. So anything in balance, out of balance, is not good.
Gotcha.
So yes, the cortisol response is needed, but not in that high alert or very high alert area, so that we just burn out.
Gotcha. So coming back to your other part of that discussion was underlying medical conditions like depression. Does other conditions like ADHD, right, or trauma someone have faced in the previous, history, is manifesting in rechanneling some of the energy into work? Or ADHD is typically when people start too many things and never finish, and that also leads to burnout. I've read some stats there too. So what's your take on that?
Thanks for bringing that, Gurpreet. I think you have done your research about burnout for sure. So looks like, yes, trauma and ADHD, they can have a higher rates of burnout. So probably we'll first touch on trauma. So the thing with the trauma is it is an distressing psychological response to your stress. So look, if someone has had already a trauma to certain things, after you had 10 hits of something, the 11th time your body responds very differently to the very first time you're being hit. If someone is hitting you, like I'm just giving an example, we don't want anyone to hit anyone. So if someone is hitting you, so the very first time, the response would be very different from the 11th time response. So what I'm trying to say is your body has wired itself in a very different way when you're under trauma. Yes, so when they are in a situation when it is overwhelming, so they are more prone for burnout than people who have not experienced trauma in a bigger level. To answer to your question, yes, trauma can be different shape and form. So to define trauma is something that you take it, which you cannot cope when it is too fast, and it is too big, too soon, too hurtful. So for a child, maybe not even giving a pie can be a trauma. Do you know what I mean? My father or mother refused to give me but that's a simple thing, how the child takes it. But there are very big traumas, like we call it the big T's. For example, there is a loss of a parent, or there is any parental separation, or there is kidnapping happening, like earthquakes, disaster. These are all big traumas. And there are also traumas that come secondary to neglect or abuse. So these are all traumas. But these are traumas of childhood. So people who have experienced these traumas will have a higher propensity in later part of their life to develop lots of diseases. The very big thing right now is talking about, we call it as ACE scores, with adverse childhood events. If your employee is someone who has experienced them in their life, they have a very higher propensity in their adult life to present with certain diseases. Particularly, they say when the ACE score is more than 4, they have a very high um, for example, suicide rate 14 times more. It's massive. 14
So the
times.
probability of
Yes, 14 times more suicide rate than the normal. So what it tells me is not to stigmatize them, to be more aware and more careful so that we can give care for them. That's basically the statistics tells us. So more amount of depression or more amount of even chronic health diseases like lung diseases or heart diseases if the A scores are more. So what does that tell us? It tells us your emotions and your hurtful emotions have a very big role to play in your physical manifestations of diseases. So it's so important, the mental health and the emotional health, to be taken care of from a very young age. That's something that now the schools and everyone is very aware of. They're getting to be aware of that when they are talking about school counselors. They're very young. They're in a very young age. They're able to know about these things. So basically, yes, traumas can also make a very big role. Or if someone, I had a patient, I just remember very vividly, he started having joint pains after he was not given a job, a particular job. He was made redundant. And even though he is right now in a stable job, he is hyper alert all the time, thinking that when is he going to lose the job? But he's not able to express it, but his body keeps the score and he expresses it with joint pains. He is presenting with reactive arthritis. So the basic thing is he's really fearful. He's stuck in that freeze mode and he's not able to open it up and come out of it.
So is that what the trauma healing is basically? Like we hear a lot. I mean, when I moved to Australia 15 years ago, there were a lot of places I would say trauma healing and treating your traumas and childhood traumas. I was questioning again. I didn't have that life experience back then, which I have now. But again, coming back to traumas and the definition itself was very confusing. A lot of people confuse just a fight with someone as a trauma. Is that simple?
Look, trauma is the meaning that you give to something. So something that doesn't even touch you could hurt the other person badly. So everyone's response to certain things would be different. So giving that element of acknowledgement that everyone is different and everyone's response is different can make a very big difference to the way we manage it. Oh, I wouldn't even bother for that. It is you, but that person, it's everything for them. That person, it shakes their life. So knowing that everyone is different and everyone has a different trauma response is very important and everyone is unique. And coming down to the trauma work, it's very important that you do the inner work. Because I come from a very Asian background where we are not allowed to express our emotions. Particular negative emotions, I would say, like anger in particular. So instead of expressing when we suppress our emotions, there are more likely the unsuppressed or the unexpressed or the suppressed emotions can also turn into things that is not good for our body. Like I believe that I have an autoimmune condition when I was young, and I feel that I am not allowed to express myself well, and that's something that I feel that is a trauma. Not able to even express yourself and feeling stuck in that moment can also be considered as a trauma. So when do we do the inner work? Is not like it is not a blame game. First, trauma work is not a blame game. Someone did this to me, someone did that to me. That is not the thing. We have to acknowledge that someone has done something to them. So you are as a person special and we hear you. To be heard is the most important thing in a trauma work. Like we hear you, yes. And second thing is to reflect and come out of it. We don't want to be in that victim state, right? Like we don't want to be in the amber mode or in the red mode. We want to come to the green mode where we can do the social engagement. Because when you're in the red and amber mode, as we said, like depersonalization, cynical, we are cynical about lots of things. We are not going to connect with people. We are not going to make any meaningful relationship either at work or at home. So the first thing to know is you are heard, you are special, and then let's do the work. What do you want? Where do you want to take us through in your journey? Where do you want me to help you in your journey? That's what I would always ask. I wouldn't tell this is what you got to do. How would you like to heal yourself? And where are the places that you allow me? Like me as a therapist, I'm also a GP with special interest in mental health. I ask my patient, where do you want to go? I'm happy to go there. Rather than telling this is what you got to do or that is what. Of course, we give the guidance, we give the guidelines, how it has to work. But at the end of the day, is the person who decides because they need to know where they are going and the direction. We can show the thing, but it is them. It's purely, it comes down to them, and we are there to support them in their journey. So trauma work is quite amazing because when you have the trauma work, you are more likely to be in the green mode rather than the red and amber mode. And it is beautiful for every place of your life, either it is work or home.
So is it safe to say everyone in this world has some trauma in them?
Absolutely, I would say that. I would definitely say that. There is unheard traumas, lots and lots of unheard traumas that we see it all the time. Like, oh, this happened these many years before, and now they're coming to light because they have that safe space too. Of course, there are lots and lots of people who have got traumas.
And those people with high traumas in the leadership level, they kind of create a work environment which may not be very supportive for other people because they haven't healed themselves. Is that fair to say?
Absolutely. That's something which we need to acknowledge. So people who are in the leadership position, they tend to suppress their emotions because they feel that as a threat. They see that as a weakness. People see vulnerability as a weakness, so they choose not to express it because if they're going to express their vulnerability, they feel that they are not going to make a difference, or they feel that that can be exploited. That's the first thing. That is fair to say, but what you're going to do is, as a leader, when you're going to be vulnerable, and if you're showing your vulnerability, if you're sharing your stories of what you went through, you're making the another person to open up and share their stories. They can relate to it, they can connect to it, and they can make a difference too. That's how the culture changes. By showing your vulnerabilities, it is encouraging someone else to open their vulnerabilities and share. It is not about pity party. That's not what we are talking about. Yes, I was vulnerable. I did this work with me, and then I turned out to be this. So don't suppress what you're going through. Just express, acknowledge, and then come out of it. Funny that you said that the first point about healing is to feel the pain. You can never heal if you don't feel the pain. You have to feel the pain, acknowledge it, and let it take the course to healing process. The first step of healing is feeling the pain. Acknowledging it. Talking to someone about it, actually, I'd say.
But there is a threat from leadership perspective. If I open up, let's say I'm a leader, if I open up and I open my vulnerabilities, I will not be perceived as a leader. Mm-hmm. So we have the likes of, I don't want to make it a political discussion, but let's say Donald Trump. He's gone through a lot, but he never doesn't look like he's going to ever express himself as a vulnerable one. Will he? No. He looks like he has got it all under control. Even when the chips were down, he was standing tall and I'm going to make it happen. I'm going to make America great again. That discussion was more prevalent from his perspective, and he kept pursuing that messaging. I mean, there is a bullying happen at that level. There is a lot of things that goes which is beyond our imagination, I'm sure. But how does that, again, how do you deal with that? Like when you know deep down you're vulnerable, you're feeling low, you're not feeling your 100%, but your leadership title or a position doesn't let you to be vulnerable, doesn't let you be the vulnerable self.
Look, when I'm saying vulnerability doesn't mean that you're not able to function. When I'm saying vulnerability, I'm saying this is what happened in my life and I dealt with it and I'm out of it. That doesn't define me. That's what I'm saying. Whatever that has happened in the past, whatever the lessons that I learned that's not me. Like the vulnerability is not me. But I went through that phase to become the resilient person. That's the message I'm trying to say. What I'm saying is, when you're saying, when I'm vulnerable, it's not that I'm saying that is what defines you. No. What you learn from that vulnerability is what defines you. He must have gone through bullying. He must have gone through lots of people talking when you're talking about Donald Trump. But that doesn't define what he is. Probably he became resilient out of it. That's what I'm coming from that place.
So I had a vulnerability, I fixed it, now I'm more resilient.
Resilient. When you say about your vulnerability, there is a chance of another person opening up their vulnerability and asking for help. So that makes them a more resilient person rather than hiding behind closed doors.
So you create a more safe environment for yourself.
Absolutely. So that is definitely true. So there is a research on bullying. For example, if someone bullies you, if someone name calls you, the bullying spirals only if you name call them back. But if I'm bullying you, example, I'm trying to say something, if you're going to be just giving me harsh words back, we are going to back and forth with our harsh words. If you're bullying me, if I'm going to say how beautiful you are, what is the next thing you're going to do? You're going to
back off.
Absolutely, absolutely. That's the environment we're going to create. It doesn't mean that I was vulnerable. What I'm trying to say is like, when you're showing something to me which is harsh, if I'm going to give something beautiful, you're going to throw that one back to me. So that's the culture we need to create. Something that is nice, and let that take a ripple effect. So rather than hiding behind doors, opening up, healing, and then that becomes a stronger version of you. Because you know what? When there are things that's been happening without your emotions being dealt, you actually are not stronger within. It's actually a superficial kind of work, I would say, like you feel empty within inside. But when you are really working or doing your inner work, you will feel the joy within, and that overflows outside. That's a very different thing. When two people achieve, there is always an element of joy in a person who has done the inner work.
So I think it also stems from some level of insecurity for people not to be opening up a little bit. And let's say somebody is feeling very insecure based on whatever be the circumstance, because of the competency at work or the corporate culture, the culture the people are in, or for some other factors which is beyond work, could be in their personal life. They're not feeling very secure. Can that also lead to burnout?
Absolutely. So because one area of the life can affect on the other area of your lives as well. Like for example, as you said, like financial stress or personal relationship stress that you have, because you're still the same person. Like you don't disconnect. I mean, there are lots of people who do well the disconnection, but still that we cannot completely disconnect out of ourselves in different situations, right? Like kind of, we need to know that if I'm going to speak my weakness, I will not be punished. I'll be supported, because I feel lots of people do have insecurities, and instead of seeing that as with the lens of judgment, I should see that with the lens of empathy. Yes, you're going through that one. Once a while, I did that one too. If I had gone through, so I'm going to support you in this situation. Because I know that as I came out of it, you will also come out of this tunnel, because it's just a tunnel.
So we spoke about trauma. Let's also address ADHD. There's a lot of Facebook feeds or social media, or this is not a trauma, this could be a trauma response. Treat your ADHD. What exactly is ADHD? Like, how do I know as an adult, do I still have an ADHD from childhood? Because I see myself doing too many things all at the same time, trying to be perfect at everything. Is that what ADHD is?
Thanks for asking that question, Gurpreet. ADHD, just let me explain what ADHD is. Please. And it is actually called a developmental disorder. Like it just happens yearly in your childhood when you're growing up. That's when it happens. It has got few components to it. We say it is an attention deficit hyperactivity disorder. So it has got few components to it. You should be inattentive, and then you'll be hyperactive, and then the third one is impulsive. So these are very classical things to diagnose someone with ADHD. So I'm not sure when you were young whether you did things that really you felt, oh my God, I should have not done it, but you did it at that moment. So that is the impulsivity bit that comes. And there was lots of thoughts earlier, we would call it as a myth, that women doesn't have ADHD, but do girls and women do have ADHD as well. They might not be in the hyperactive side, but they do have an inattentive side to them. Like So that's why lots of girls, they miss out on that ADHD diagnosis because they were so nice girls, they're very shy, but they are inattentive. So many women get diagnosed with ADHD in their adult life um, because they were of the inattentive type. And funny enough, I had people who come for weight loss medication, and there is a weight loss medication which we put on, and that helps to focus them. It's kind of like a stimulant. And then they go back and get their ADHD diagnosed. I'm not sure if you know, like with ADHD, with an adult type, they have come with other comorbidities. One is anxiety, depression, obesity. So there is a very big component of adult ADHD and obesity, which means like increased weight gain. When we go back to the research about why it's happening, so people with ADHD, they use food as comfort to calm them down. So that's why they put on weight, because of the impulsive behaviors. I'm just stressed now. I don't know how to emotionally regulate myself. Let's use food as an ADHD. Food as an method to calm them down in ADHD. So yes, to answer to your questions, yes, you can have it in a young age and that's not been diagnosed, and later in the life that we can get to be diagnosed with ADHD, particularly the adult ADHD. And yes, that can play a very big part in burnout, purely because just people are running in the treadmill. They are not focused, their concentration is less, and they keep doing it, and they are the people who can get burnt out more, purely because particularly in these people, they are hyper focused on certain things, so they put all their energy out and they don't prioritize their stuff. So what it means is like they drain their energy out very quickly because everything is about maximum for them. They need to do it completely and they lose focus on certain other things that is also important. So that can be playing a big role as well for burnout.
So as burnout is very loosely termed, a lot of people use it, oh, I'm feeling burnout today. Or with ADHD, I think I see that very similar, like I was using the phrase for myself. Obviously, I have not gone through that whole process, and apparently some of the symptoms aren't really quite, relevant to me. But we see that a lot on LinkedIn these days. People are talking about, I'm a ADHD type, and I'm a ADHD brain. They self-diagnose it. So what's the best first line of treatment? Or for example, if I want to diagnose myself with ADHD, where should I go first? To a GP or a psychologist, a psychiatrist? What's the place to go?
Thanks for that question. That is very important that you ask that question, purely because lots of things can mimic ADHD. For example, iron deficiency. First, we have to rule out through a blood test simple things first. Get some physical conditions ruled out before even thinking about ADHD. Another thing is the sleep. When the sleep is corrected, lots of people's performance and concentration can improve. So please don't self-diagnose. I would want everyone to make sure they go to the GP and get that checked, at least the physical diagnosis component of it checked before they put themselves into the box, because that's very important. And coming back to that ADHD assessment, in adult ADHD, there are different things that we do. We have questionnaires, and for children, there are lots of places they do ADHD assessments. Just they're particularly dedicated for that. And there is also ADHD Australia that is really good. They do that work too. So there are different things that we can do for that assessment. So we can't really self-diagnose ADHD. Particularly, I had few people who come in and they said that, like, I have ADHD, please give me medication, stimulants, because stimulant is one of the things. Sorry, I can't do it. And when we ask questions for ADHD, we need to ask their parents about how the kid behaved. Lots of clients, like, or my patients, parents would have already passed away. So it's really a bit of a tricky situation for them, when they are coming in their very adult life. So look, what I would say is, like, if someone has crossed so long of the age just to come to that stage, and if it's not affecting their functioning, so you can do more of an ADHD coaching, or there are some executive functioning coaches there. Like, when I'm saying executive functioning, so usually with ADHD, the main thing that gets affected is their time prioritization, priorities with your time, and executive functioning. They are very out of the box thinkers. But the problem is the organization skills and execution doesn't happen. So having someone like a coach or even a therapist who can help them develop those skills should be more than enough, I would say. But if someone is not able to completely function, then it's a different story. If it's affecting their work or if it's affecting something else in their life, definitely then we have to get them to get medicated for that. So those are the two. There are different spectrums in it. So I would say ADHD is a boon for people when they are out of the box thinkers, because they are problem solvers. They can just give you solutions, amazing solutions.
Gotcha.
Yes.
So, thanks for covering this up. Now, what are the self-care tips? Are there frameworks people can use? Because now we've discussed quite a bit on burnout, ADHD, trauma. Where does the line of treatment starts? Let's start with self-care. What can I do today if I'm going through a burnout that can start the process for me to be from amber or red mode to green mode? And then what are the other strategies or frameworks which I can use to keep the burnout away from me?
Thanks a lot for this question. It means very important, because I learned self-care in very later part of my life. I wish I had known about self-care before. Everyone needs to have a proper self-care framework, I would say. People think self-care is just very physical. It's not. It's very multidimensional when I say self-care. So it's physical. Your pillars. What are the pillars? Eating well, making sure you have a good balanced diet that can really make a very big difference, and making sure you have less coffees, because they are all caffeine in it and it can just push yourself and it can make you feel agitated and stuff like that, so that you can have easy burnout yearly if you're going in for more amount of caffeine and drugs like that. So having a great sleep, having a good sleep routine. I would highly advise someone to invest in a good mattress, I would say, because we spend at least 8 hours of our time in bed. So making sure you have a good sleep routine with a good bed and mattress would make a very big difference. The other thing I would say is social connections. We are a herd community. We don't do things in isolation. And we even say that loneliness is equal to, like people just fear loneliness secondary to death, they say. It's kind of so huge. Loneliness can actually reduce your life expectancy too. So having someone trustworthy in your life and connecting with people, the social connection can make a very big role for you. And being in the nature. Nature is wonderful. When you go out in the nature, when you are in the sun, there are certain beautiful, wonderful chemicals which is free of cost that is being produced for you, like serotonin, like your good stuff, even melatonin. To produce melatonin, you need sun. So people think, oh, melatonin, we don't need sun. No, we need cortisol. For the sun comes in, the cortisol comes up, and the sun comes, and then the night shade, those things are also stimulated because of the melatonin. So we need both the ends as well. The sun is very important. So nature is very important. And knowing your triggers. So when I'm doing this, my body responds to that one. So when I'm taking more than 2 cups of coffee, I'm agitated. So knowing yourself can also help. So that is a physical component. Then your psychological components, where you can go actively involve yourself in some meditation or a relaxation or yoga. They say, like women in particular, in the middle-aged women, there is lots of research on this one, going for a CBT or a yoga-based therapies are very powerful. So because women go through lots of transition during that time, so they also get burnt out a lot. So having that CBT, which is a cognitive behavioral therapy, and yoga and CBT combined can have a very bigger results for them, because moving your body can help you as well. So having that psychological component would be helpful. I would say emotional and spiritual are very important too. Yeah, having something that your belief systems and you connect with people of your same frequency and same belief systems could also be a very big role in terms of your self-care. So self-care is not just physical, that's what I would say. Like it's a very wider dimension, and your community or your environment. So make sure that you're not in your toxic culture. Make sure your boundaries are right. Make sure you take your leave and just enjoy, pause and reflect. There is always rest and recovery. I would want to quote on one book called as Brain Energy by Christopher Palmer. So what happens is when people don't move, for example, the hibernation animals, they sense danger outside environment and they conserve energy and they don't move. So when it happens, what happens is your brain senses danger and you become so low, lethargic and everything. So movement plays a very big role. We keep moving forward. So that's the important thing. He's a Harvard professor who said that, like, yeah, just shutting down, simply sitting at one place could be equal to sensing danger in your environment, because you're telling your brain, oh, you're in danger. So you're going to conserve your energy. So having a more active, not a sedentary lifestyle, more active lifestyle could play a very big role as a part of your self-care too. Do you have any hobbies, Gurpreet?
Yeah, absolutely. I do. And I do try now as a part of my self care, I do go out, do my tennis and other stuff I do. Now, you briefly mentioned about, the self care. Now, on the extension of that, we discussed values offline, right? That doing things which is not in line with your values can also lead to burnout, right? Doing a job which you don't think is aligned to value, or you've been asked to do certain things in the job which you don't think is not aligned to value, that can also lead to burnout. Or living the life which is not aligned to your value for whatever reasons you have to live, a certain phase of your life, can that also lead to burnout?
Oh my God. Good that you brought this one up. It's an amazing question. I would say if someone has to take anything from this podcast, I would talk about this one purely because I'm not sure if you have heard about Ikigai. Ikigai is a Japanese word where you have three things to be aligned together: what you're passionate about, what you're paid for, what your world needs. So I want everyone to find the Ikigai, like having your values that matches your action. So when your compassion, what you really feel valuable, when your compassion comes in alignment with what the community needs, and if you're paid for, then that is your Ikigai. So I would request everyone to find the Ikigai. That's where the joy is.
That's awesome. Thank you, Dr. Prarthana, for coming here and sharing your wisdom on burnout. And it was absolutely a pleasure to have you here.
Thanks, Gurpreet. It's been a great initiative what you're doing. I know you're an IT person and you must have been with numbers and everything, and learning about emotions and learning about people and making a difference for people. That speaks a lot about you. And thanks, and keep doing the good stuff that you're doing. And thanks a lot, and thanks for having me here.
Thank you. Appreciate it. Cheers.
Thanks.